number of COVID-19 cases continues to rise globally and right here in Guyana. Therefore, we encourage everyone to practice social distancing, wear a mask if you have to leave your homes, and wash your hands thoroughly and frequently as we strive to stop the spread of the virus. Welcome to InfoHub for Tuesday, April 28. Thanks for joining us. First up, the National COVID-19 Task Force on Monday held its weekly statutory virtual meeting. Among the decisions taken was the approval of the request from CARICOM for officials to travel to Guyana on Thursday, April 30th for the purposes of overseeing the recount of ballots by the Guyana Elections Commission. The NCTF also deliberated on the issue of the post-May 3 measures and requests for charter flights for persons who are stranded overseas to return to Guyana. However, the task force says no final decision was taken on the matters, both of which require further deliberations. Let's tell you now that the Ministry of Public Health has introduced a mobile unit and 2 designated COVID-19 facilities, encouraging more persons to be screened for the coronavirus. More in this Delicia Haynes report.
Firstly, the mobile unit will visit specific areas to do screening for persons who think they may have been in contact with a person testing positive for coronavirus. Deputy Chief Medical Officer Dr. Karen Gordon-Boyle said this will be extended to marketplaces.
Being a mobile unit, we also have plans for the unit to go into other areas where what we consider hotspots, where we've had a few cases emanating from, just to go and check and see what's going on in that facility. We're also thinking of places like the markets, where we recognize from our epi data that a lot of the contacts of our cases would have traversed certain marketplaces.
Meanwhile, Deputy Regional Health Officer Region 4 Dr. Christopher Seatram explained what will be done at the facilities set up at the Paradise and Herstelling Health Centers.
As soon as you enter the premises, you wash your hands. You are then reached by trained personnel who is going to do the initial, we call triage 1, or who will do initial screening where your signs and symptoms are noted. And in the event that you have criteria, you meet criteria to be tested, then you move on to the other facility where we do testing. We have an enclosed booth. As you can see there, we have an enclosed booth where our trained personnel will be doing swabbing. The samples are taken off and then sent to be analyzed in Georgetown.
Together, these services seek to ease the patient load at the Georgetown Public Hospital while mitigating transmission in the region with the most positive cases to date. The mobile unit and the 2 COVID-19 facilities are set to work from 9 a.m. to 3 p.m. Mondays through Fridays. However, based on the demands which may have to be met, these hours may be extended. For InfoHub, Delicia Haynes.
The Chinese government has donated a number of personal protective equipment to Guyana's public health sector to aid in the nation's fight against the novel coronavirus. Kellon Rover tells you more.
The items were handed over on Monday during a simple ceremony held at the Public Health Minister's Secretariat, Bertram. Among the items received by the ministry's Permanent Secretary Colette Adams were protective face masks, infrared thermometers, medical protective goggles, and isolation shoe covers.
On behalf of the Ministry of Public Health and the government of Guyana, I would like to thank the Chinese government and the people of China.
Deputy Chief of Mission at the Chinese Embassy, Chen Zilai, said China and Guyana have a profound international relationship since 1972, and it is important for the two nations to cooperate even as they battle a global pandemic.
That's why the first batch of PPEs or medical supplies now have arrived at Guyana, and we are able to do this transfer. And according to my knowledge, there will be more coming. And I think that through the joint efforts of the Chinese government and the Guyanese government, that we can fight, we can win this battle against coronavirus.
Director of the Department of International Cooperation at the Ministry of Foreign Affairs, Forbes July, explained that the timely gesture by China is as a result of the country's international bond.
The ministry is also being involved with the Chinese embassy in terms of facilitating an exchange by Chinese experts on COVID-19. But beyond that, we see it as a much more extended process, because COVID-19 obviously is not only affecting lives, but livelihoods. And the economic impact would certainly be dire, and as we're seeing. And so we see at Foreign Affairs, we see it as the next stage in terms of engaging our international cooperation partners in terms of alleviating and mitigating the economic and obviously social effects.
For InfoHub, I am Kellon Rover.
Meantime, the United States government has committed an additional $1.7 million to mitigate the spread of the COVID-19 outbreak in Guyana and the rest of the Caribbean. The United States, via U.S. aid, is providing life-saving support by coordinating with the government of Guyana, international humanitarian partners, and other stakeholders to identify priority areas for investment. Through this assistance, U.S. aid will support infection prevention and control in healthcare facilities and communications to help educate people on steps they can take to prevent and respond to the spread of the virus through country-specific media campaigns. U.S. aid also helps countries train and support rapid response teams to investigate cases and conduct contact tracing. Noting that an infectious disease threat anywhere can become a threat everywhere, the United States is calling on other donors to contribute to the global effort to combat COVID-19. More news ahead after the break. Stay with us.
Meet Terrence and Shabana. Both believe they've been exposed to COVID-19 and were advised by the Ministry of Public Health to quarantine themselves at home. It's a normal working day, and Terrence grows tired of home quarantine guidelines. So he heads off to work using public transportation. Now all the passengers and his co-workers are in danger of contracting COVID-19 from Terrence. After work, Terrence heads straight to the gym for daily exercise. He shares the same exercise equipment with many others that day. Later on that evening too, Terrence heads off to play several rounds of dominoes with some friends. By breaking the quarantine rules, Terrence has endangered the lives of the passengers, his co-workers, members of his gym, and his friends with whom he played dominoes. By contrast, Shabana practices social distancing. She works from home every day, and in the evenings, she video chats with her family and friends to stay connected. Shabana is also obeying all the guidelines that the Ministry of Public Health says we follow when quarantined at home. Shabana has infected no one. Let's all do our part and practice physical and social distancing by avoiding unnecessary travels and staying home from large groups of people, including our families and friends. A message from the Ministry of Public Health in collaboration with PAHO WHO. For more information, visit our website at www.health.gov.gy or visit our Facebook, Instagram, or Twitter page.
Welcome back. Thanks for staying with us. A smart classroom accommodation for students in outlying regions and other infrastructural development at the Bertram College of Public Service are on the cards. This comes on the heels of a meeting hosted on Monday with the newly appointed director, Dr. Mark Curtin, Public Service Minister, the Honorable Tabitha Sarabohali, and other staff. Here's more.
I had a meeting with them. I think they're very keen, and they're working assiduously alongside the lecturers. Well, I commend the staff for ensuring the continuity of the delivery of the program by distance. Once we work together, we can ensure that there's no slippage, no gap in relation to delivery.
After a tour of the institution, Dr. Curtin noted that there are a few areas he is considering, especially the establishment of a smart classroom among other infrastructural development.
There's a classroom that is already beginning to become a smart classroom that will be necessary. to ensure that down the road we can have somebody teaching a course from anywhere in the world. And so that will enhance the quality of the program.
The officials are also looking at accommodation to house students residing in outlying regions while they are pursuing their studies.
We look at the accommodation for the students who come from out of region, from regions 1, 2, they tell me region 9, 10, 7. And I think we need to look at, in the medium and long term, the possibility of converting some of the buildings here into a dormitory for the students. That would ensure, first of all, not only the development of camaraderie, the kind of mixture of cultures that could enhance the type of personalities that would be necessary for a changing public service in Guyana.
Neola Damon, InfoHub.
More COVID news. The World Health Organization is concerned about the impact the novel coronavirus pandemic will have on other health services, especially for children. The WHO Director General, in his media briefing on Monday, noted that while children may be at relatively low risk from severe disease and death from COVID-19, they may be at high risk from other diseases that can be prevented with vaccines. As World Immunization Week is being observed, the Director General stressed that vaccination is one of the greatest success stories in the history of global health. Read more of this story on our website. Since Guyana confirmed its first case of the novel coronavirus on March 11, many pharmacies and other businesses hiked the prices of essential items such as sanitizers and vitamins. However, one business owner refuses to follow this regrettable trend. Neola Damon has that story.
Owner of Health Max Pharmacy, Steve Brughagen, is one of the business owners who refuses to hike prices during the COVID-19 pandemic. Brughagen, who is also a pharmacist, told InfoHub that the inflation of prices was not the way to go, since it puts a severe strain on the pockets of citizens.
Yes, the pharmacy is a business. Yes, you want to make money and whatnot. But my intention is that I like health. That is something that I grew up, investing into. And into my neighborhood, I prefer to make it at least reasonably affordable for everybody, whether it be vitamin C or just something to look after the skin, whatever the case may be.
The 31-year-old relayed that while he finds it challenging to procure some essential products at a reasonable price, he has been able to utilize his knowledge as a supplier to obtain these items without suffering any loss.
It's a struggle to get certain products still, and even when you do get those products, they're higher, right? And it might not change in the near future. Hopefully, I'm hoping for the better.
Located at 37 Joseph Polydor Street, Georgetown, the pharmacy officially opened its doors earlier this year. Its business hours are from 2 p.m. to 8 p.m. daily. The pharmacist noted that from the hours of 4 p.m. to 8 p.m., most of its customers are nurses. Copies of the health and safety guidelines outlined by the Ministry of Public Health and the World Health Organization, WHO, are placed strategically at the entrance to ensure customers can read and be encouraged to follow them. Neola Damon, InfoHub.
Remember to do your part to ensure you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical care early, but call the hotline first. DPI would like to take this time to extend greetings to all our Muslim brothers and sisters as they begin the holy month of Ramadan. That's all for today. Connect with us on all our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. Also, subscribe to our website, dpi.gov.gy. Your Bridge Report is up next. Stay safe and goodbye for now.